300,000 years ago, we all had inherent connection in the tribes that we were embedded in. That's such a good question. And even apart from the issue of chronic disease, loneliness is an epidemic in our country, in our culture. And in some ways, I think that loneliness can actually feed the development of chronic disease. And then chronic disease can feed loneliness in a real difficult, vicious cycle. So to get out of that vicious cycle, we need to intentionally step into and create community and connection. 300,000 years ago, we all had inherent connection in the tribes that we were embedded in. And we need to find ways to intentionally recreate that. So that can be through support groups, right? Let's say that you have a diabetes support group or a grief support group or a cancer support group. And studies show that when you get into these support groups that they markedly improve outcomes. They reduce mortality, they increase lifespan, they reduce suffering. So connection is crucial. But there's other ways of getting connection through spiritual communities. Even if you don't happen to be theistic, you can still find communities. One of the things that we know promotes happiness and fulfillment and reduces loneliness is the combination of loving connection, service, and purpose. So ironically, let's say that you're dealing with a chronic illness, but there's some way that maybe you can do some volunteer work that would be helpful in service to other people. That is incredibly healing. So if we can flip it around from, oh my God, I've got this terrible illness, absolutely we need support, right? But if we can flip that around and ask ourselves, well, how can I also be of service to others, right? That kind of change in mindset, again, just very, very powerful for healing.